there is a new weight loss trend taking over social media for users looking to shed some pounds.
Weight loss.
Weight loss.
Easy weight loss.
Miracle diet drug.
Miracle weight loss drug.
Yes, Ozempic, the game-changing medication, is creating a buzz in Hollywood for weight loss. But here's the catch. Many are jumping on the trend without fully understanding it. In this video, we're breaking down everything you need to know about Ozempic. How does it work? How do you inject it safely? Who should consider it? There's a lot to unpack. Stick around until the end because the final topic could completely shift your view on Ozempic and whether it's the right choice for you. What is Ozempic and how does it work? Ozempic is the brand name for semaglutide, a medication mainly used to help manage blood sugar levels in people with type 2 diabetes. But what really catches people's attention is Ozempic's surprising impact on weight loss.
Ozempic, a popular medication typically prescribed for people with type 2 diabetes, is reportedly being used off-label for weight loss.
So, how exactly does it work? Let's break it down into 3 simple steps. First, Ozempic boosts insulin production. After you eat and your blood sugar rises, it helps your pancreas release more insulin. This hormone allows your body to use sugar for energy and keeps your blood sugar levels in check. At the same time, Ozempic lowers the production of glucagon, a hormone that usually raises blood sugar. By reducing glucagon, Ozempic helps keep your blood sugar from spiking too high. Finally, Ozempic impacts appetite, which is where its weight loss effect comes into play.
Ozempic is a GLP-1 agonist. It slows down how fast your stomach empties food, and you're fuller longer with smaller portions. And it also acts centrally in your brain to reduce appetite.
By making you feel full faster, you naturally end up eating less, which leads to weight loss. Now that you know what Ozempic is and how it works, let's go over how to inject it properly. Follow this step-by-step guide to make sure you're doing it safely and correctly. First, start by washing your hands with warm water and soap, or use hand sanitizer. Clean hands reduce the risk of infection.
So the first thing I do is prep my pen with a new needle. I make sure that the label on the pen matches the medicine that I was prescribed to take, and the liquid in the pen is not cloudy. See, it should be clear, like this. I see.
Next, attach a needle to your Ozempic pen, following the instructions that come with the pen.
Just pull off the paper tab, push it, and turn till it is on tight. Pull off the outer cap, and then the inner cap.
If you're using a new pen, it's important to check the flow to ensure you're getting the right dose. This step ensures everything is working properly before moving forward.
So first, I turn the dose selector to the flow check symbol. Next, press and hold in the dose button until the dose counter shows 0. And the 0 must line up with the dose pointer. A drop of Ozempic will appear at the needle tip.
Now, set the dose your doctor has prescribed on the pen. Always double-check that you've set it correctly to avoid any mistakes since the dosage is not reversible.
Again, all you gotta do is turn the dose selector until the dose your doctor prescribed appears in the dose counter.
Next, choose your injection site. Common spots include your stomach, the back of your upper arms, or your upper thigh. If you're injecting into your stomach, make sure to stay at least 2 inches away from your belly button and avoid the waistline. Clean the area with an alcohol wipe and let it dry completely before injecting.
Mine goes in my abdomen, so I select my abdomen. I'm going to pinch it. I like to insert it at a bit of an angle, so I'm going to insert the needle.
Once you've inserted the needle, press the injection button located on top of the pen to release the dose.
And then I put my finger on the end here and click this button, and you'll hear it click as it inserts the dose, and this plunger moves down.
Before removing the pen from your body, hold it in place for about 6 seconds to make sure the full dose is delivered.
And it's done. And so I leave mine in for 6 seconds. Different medications are different. And then I pull it out at the exact same angle.
Can we inject Ozempic and insulin in the same area? When using Ozempic alongside insulin, there are a few things to keep in mind. While both can be injected in the same body area, they shouldn't be injected right next to each other. Doing so could affect how quickly or slowly the body absorbs each medication, leading to less predictable results. It's also important not to keep using the same spot over and over. Repeated use of the same area can cause irritation, swelling, or lumps under the skin. To avoid this, it's a good idea to rotate your injection sites regularly. And just to be cautious, if you want to reduce the risk of bruising, avoid injecting near blood vessels or moles. Recommended dosage and frequency. Now let's talk about how much Ozempic you should take and how often.
How can you practically use Ozempic? Prescription label says you start with the 0.25 milligram weekly for 4 weeks, and then you go to 0.5 milligram for the following 4 weeks.
When you first start, the typical starting dose is 0.25 milligrams once a week. This lower dose helps your body get used to the medication and reduces the chances of side effects in the beginning. After about 4 weeks, your doctor may increase the dose to 0.5 milligrams once a week, depending on how your body is reacting. This slow increase allows the body to adapt to the medication. If you're doing well and need extra help with blood sugar control or weight management, your doctor might raise the dose every 4 weeks, all the way up to a maximum of 2 milligrams once a week. Keep in mind that the right dosage varies from person to person, based on how your body responds and your specific health needs. As the dosage goes up, you might notice some side effects, so it's really important to start slowly and always check in with your doctor before making any changes. How long do Ozempic pens last? Ozempic pens come in 3 different colors: red, blue, and yellow. Each color represents a different strength and dosage of semaglutide: red for the lowest doses, blue for intermediate, and yellow for the highest. The red Ozempic pen is the first one you'll use, allowing you to start your treatment journey with a lower dose. It contains 2 milligrams of semaglutide and offers 2 dose options: 0.25 milligrams or 0.5 milligrams per injection. You'll get 8 doses at 0.25 milligrams or 4 doses at 0.5 milligrams. You typically start with the 0.25 milligrams dose and may move up to a maintenance dose of 0.5 milligrams. After completing the initial treatment phases with the red pen, your doctor may increase your Ozempic dose to 1 milligram once a week using the blue pen. The blue Ozempic pen contains 4 milligrams of semaglutide and provides 4 doses at 1 milligram per injection. Depending on your needs and how well you tolerate the medication, you might later be prescribed the maximum dose of 2 milligrams once per week with the yellow Ozempic pen. The yellow Ozempic pen contains 8 milligrams of semaglutide and provides 4 doses at 2 milligrams per injection. Not all patients will progress to the yellow pen. Some may find that the lower doses are sufficient for their treatment. The duration of how long an Ozempic pen lasts depends on your prescribed dosage and the specific pen type you're using. Always consult your doctor for personalized advice regarding your dosage. Ozempic pens operate on a click system. Each click dispenses a fixed amount of medication, making it easy to measure your dose accurately. If you're unsure how many clicks are needed for your prescribed dosage, you can check the chart here. Feel free to pause the video and take a screenshot if you need it. How long should I take Ozempic? One question a lot of people have is, how long do you need to take Ozempic? Well, it really depends on your situation and why you're using it. If you're using Ozempic to manage type 2 diabetes, it's usually a long-term treatment. Many people stay on it for years, as long as it continues to help control their blood sugar levels and doesn't cause any major side effects. But what about weight loss? That's another common question. The good news is many people start seeing changes within the first 4 to 6 weeks. Studies have shown that people using Ozempic for weight loss usually lose about 5 to 10% of their total body weight within a few months. This could mean losing 1 to 2 pounds a week, which adds up to roughly 8 pounds in a month. Of course, everyone's journey is different, so while some may see faster results, others might take more time. It's important to chat with your doctor to assess how Ozempic fits into your long-term health plan and discuss any potential risks. What happens if I miss a dose of Ozempic? Ozempic is taken once a week, on the same day each week, at any time that works for you. But if you miss a dose, don't stress. There are ways to get back on track. The best course of action is to take the missed dose as soon as you remember, as long as it's within 5 days of when you were supposed to take it. This helps keep your medication effective and ensures your treatment plan stays on track. However, if more than 5 days have passed, it's better to skip the missed dose and continue with your next scheduled dose. Never take 2 doses at once to make up for the missed one. This could increase the risk of side effects or complications. Stay consistent and consult your doctor if you're unsure about what to do. Can I use an Ozempic needle twice? It's important to know that you should never reuse an Ozempic needle. Reusing needles can increase your risk of infection and may reduce the effectiveness of the medication. Each Ozempic pen comes with a single-use needle, designed to ensure you're getting the correct dosage while minimizing infection risks. For your safety and the best results, always use a fresh needle for each injection. Can I share Ozempic with others? We all know Ozempic can be expensive, and some people might think about sharing it to save money. But here's the thing. You should never share your Ozempic pen, even if you change the needle. Sharing it can lead to serious infections, and it's just not safe. It's always better to get your own pen. If the cost is a concern, check with your insurance to see if they can help, or have a chat with your doctor about other options that might be more affordable. Should I take my Ozempic with food? You can take Ozempic with or without food, depending on what works best for you. Some people find that taking it with food helps reduce stomach upset, while others may feel fine taking it on an empty stomach. The key is to monitor how your body reacts and choose the option that minimizes any discomfort, like nausea. If you continue to experience significant nausea, regardless of whether you take it with food or not, it's a good idea to consult your doctor. They may adjust your dosage or suggest alternative treatments to better suit your needs. Who shouldn't take Ozempic? Ozempic isn't suitable for everyone, and there are a few important things to consider. If you or anyone in your family has a history of medullary thyroid carcinoma, also known as MTC, a type of thyroid cancer, or multiple endocrine neoplasia syndrome type 2, also known as MEN2, Ozempic may not be the right choice for you. This is because it could potentially trigger complications related to these conditions, which is something you definitely want to avoid. Additionally, if you are pregnant or breastfeeding, Ozempic is not recommended. There isn't enough information about its safety for your little ones, so it's best to explore other options if you fall into this category. How to store Ozempic and its expiry date. To keep Ozempic effective and safe, you need to store it properly. If your pen is still unopened, the fridge is the best spot. Just make sure it stays cool between 2 to 8 degrees Celsius or 36 to 46 degrees Fahrenheit. Once you start using the pen, you have two options. You can either keep it in the fridge or store it at room temperature, as long as it's not hotter than 30 degrees Celsius or 86 degrees Fahrenheit. Just remember to always put the cap back on when you're done using it to protect the pen. One thing you should never do is freeze it. If it's been frozen, you'll need to throw it out because it won't be safe anymore. And don't forget to store it somewhere kids or pets can't get to it. As for the expiry date, unopened pens are good until the date printed on the label, as long as they've stayed in the fridge. But once you've opened the pen, make sure to use it within 56 days, no matter if it's in the fridge or at room temperature. Keep an eye on these dates so your Ozempic is always safe to use when you need it. Who is the ideal candidate for Ozempic? Ozempic is mainly for adults with type 2 diabetes who need help managing their blood sugar. But not everyone is right for using Ozempic for weight loss. The ideal candidates are those with a BMI over 30, or a BMI over 27 combined with at least one weight-related health condition such as high blood pressure, type 2 diabetes, or high cholesterol. Ozempic can also be helpful for people with type 2 diabetes who are at risk of heart disease, as it helps lower the chance of major heart problems. That said, anyone using Ozempic should have realistic expectations. It's important to stay committed to a healthy diet, regular exercise, and other lifestyle changes that can support weight loss. Is microdosing Ozempic safe without medical guidance? According to a recent study from the Ohio State University's Wexner Medical Center, 1 in 4 adults in the U.S. would consider using weight loss drugs without a prescription. If you're trying to lose weight, Ozempic might seem like a tempting choice. You might even be wondering, can I microdose Ozempic on my own without talking to a doctor? The short answer is no. You should never try to self-medicate with Ozempic. Microdosing without professional guidance can be risky and lead to serious health problems.
Honestly speaking, microdosing is not really an accepted terminology or even an accepted dose when Ozempic is used properly.
While Ozempic is not officially FDA approved for weight loss, many people who take it do experience significant weight loss. Technically, weight loss is a side effect of Ozempic, even though it's not its primary purpose. But the side effects don't end with weight loss. Check out our next video where we'll dive deeper into some of the unexpected side effects of Ozempic.